This is the first in a series of discussions and resources that we're providing to help you better examine the market, social, and regulatory issues that influence the way healthcare is provided, paid for, and evaluated in our system. Regardless of your role, this information and these resources will help you to be more successful. In your role as a patient, you may be moved to become more engaged in your healthcare as a result of what you'll learn here. You may learn the type of questions to ask, how to ask these questions, and how to interpret what you find out in the context of the complex system of healthcare. By becoming an active partner in your healthcare, you can break out of the outdated paradigm of having your care delivered to you and learn how to create your own health by partnering with the system that we have to work with. If you're a healthcare provider, you may learn more about the broad and powerful forces that are influencing the way you practice. You will understand the motivation behind the unparalleled change that is currently at work, the outcomes that this change is geared to achieve, and as a result, how you can most successfully adapt and even thrive to partner with and provide the best care for your patients while at the same time delivering the metrics you are being required to deliver. If you're in industry, you may learn more about how patients and providers are changing in response to external pressures and what you can do to ensure that your organization is equipped to provide the value customers are looking for going forward. These solutions will go far beyond what has been working for you for years. Not every player in the industry will adapt quickly. Those that do, however, will have the opportunity to create a distinctive competitive advantage and become the partner to which they have been aspiring for years. Those who continue to execute business as usual will either rapidly fall behind or find themselves simply out of business. My guess is that if you are with industry, you have aspirations to disrupt the market. First, you must be willing to disrupt your organization. More team building exercises, a new company logo, or hiring a different vendor will not be enough. Let's start by taking a look at the U.S. healthcare system today and how we got here. The U.S. spent $3 trillion on healthcare in 2013. That's about $9,000 per person. Now, perhaps $3 trillion is the right amount. Perhaps it costs $3 trillion or $9,000 per person to provide quality healthcare to our population. Let's put it in context. Gross domestic product, or GDP, is the value of all goods and services produced. In 2015, the United States will spend roughly 18% of its GDP on healthcare. Compared to the OECD, which is a group of industrialized nations, the U.S. spends twice the OECD average on healthcare as a percentage of GDP, and 1.5 times as much as the next nearest country. The World Health Organization ranks the U.S. 37 in efficiency of healthcare spend. So, we are spending significantly more as a percentage of all the wealth that we produce on healthcare, and our results don't reflect that the money is well spent. So it's not as though we're spending significantly more than other countries, but we're getting better outcomes. We're spending significantly more, twice the OECD average, and our outcomes are worse. Looking forward to see where this trend is taking us, there are a number of different estimates by different groups, but one of them is that by 2060, we will spend 40% of our GDP on healthcare. That is arguably unsustainable. That will arguably bankrupt the country. If you're taking 40% of all the goods and services, the value of the goods and services, or the wealth that your country produces in a year, and you're pushing that to healthcare, you're not spending it somewhere else. You're not spending it perhaps on defense. Perhaps you're not spending it on infrastructure, roads, things like that, bridges. There's a zillion things you could take it away from, and you have to take it from somewhere if you're going to put it into healthcare. That is the number that has everybody terrified, and that is the number that has taken the discussion around healthcare reform and changing the way we do things and moved it from a discussion to action. That's why we're seeing this incredibly widespread and thorough change in the way healthcare works in the US, because it has to change or it could potentially bankrupt us. Now, there's some factors driving this that I'm going to talk about, and there's a lot more than what I'll discuss, but I'm going to choose 5 right now that are absolutely influencing this spend. The first factor we'll look at is shifting demographics. We have 10,000 people every day in the United States who become 65 years old and therefore eligible for Medicare. What does that mean? Well, if you think about it, as you get older, your body, generally speaking, isn't as healthy as it was when you were younger. So somebody who's 20 years old across a population is less likely to consume the same amount of health care as someone who is 65 years old. The older you get, your body just breaks down a little bit and it costs more to provide health care. So if you have 10,000 people every day who turn 65 and become eligible for Medicare, that tells us that there's a lot of people who are moving into the most expensive age group to provide health care for. On top of that, they're living longer than ever before, and that's great. We want people to live a long time, but financially it puts a burden on the system. You have a lot of people becoming older into the most expensive age group to provide health care for, and when they're there, they stay there a long time. That's one powerful dynamic. Another dynamic is waste. The Institute of Medicine estimated that in 2009, 30% of total U.S. healthcare spend was wasteful and unnecessary. That's about $765 billion that we did not need to spend. Now, is the number exactly $765 billion? Maybe it's $800 billion, $900 billion, maybe it's $600 billion. It's an estimate, but I think we can all agree that wherever it falls into that range, it's a lot of money and it's wasteful money that we didn't have to spend on healthcare. And there's a lot of reasons, here's some of them, that are estimates of where that money is being wasted, but the bottom line is it's money that can be saved if we get a little smarter about it. Another dynamic is the history of a fee-for-service structure for payment. What that means is, historically, if you went to a healthcare provider and that healthcare provider told you you needed a particular service and then performed that service, as long as the provider filled the form out correctly and sent it into the payer, whether it's Medicare, Medicaid, a commercial insurance plan, whatever the case may be, as long as they fill out the correct form and they fill it out correctly, and there are no red flags or nothing on that form to attract the attention of the payer that something could be wrong, they would get paid. That's not to say that filling out the form is easy, because it's not. Billing and coding require specially trained personnel to navigate the specific requirements for process and paperwork that each payer has. Which brings us to our next topic. Another factor is that the complexity of the system itself drives up costs. There's so many people that want to get their hand in the cookie jar because there's money to be made. You have hospitals, you have various different specialties of healthcare provider, physicians, you have companies that make MRI machines, you have consultants who go in and talk about ideas and ways of improving business to all of these different providers of goods and services. You have pharmaceutical companies. You have information technology companies designing software and systems so that they can manage their information. And they're building the systems, they're training them on the systems. There are just so many players, and each of these players needs to make a profit margin. They wouldn't be in business if they couldn't. So every step of complexity that the system has increases cost because it's additional profit margin that somebody has to make. Everybody wants to stand around the money tree and grab a leaf because the money tree is big and there's a lot of leaves to be had. The final factor I'll talk about is the impact of consumer cost share on consumption choices. And sort of an easy way to illustrate this is if I walk down the stairs and I take a bad step and I twist my ankle, if it hurts, but I know it's not broken, I have a decision to make. Do I go see the doctor or do I not? If I have a $20 copay, I'm likely to make a very different decision than I would make if I had to pay the full cost of that visit, which could be $125. For $20, if my ankle hurts, it's swollen, I might just go in just to be safe and see if the doctor can do something for me to make it feel better or possibly get, recover, get better a little quicker. For $125, I may just take a pain medication that I'll buy at my local pharmacy. I may tape it up, and walk it off, because that's a lot of money to spend, and I may choose to consume differently if that's going to hit my wallet harder. Right now in the country, most people are insured. It's about 87–90% of U.S. citizens have some form of insurance. So not everybody has it by any means. There's millions of people who are uninsured. But across our population, most people have some sort of insurance, and that's driving consumption. It wasn't always that way. In 1900, the average American spent $5 a year on healthcare. That's the equivalent of $100 today. People paid for healthcare when they absolutely needed it, such as when they took the bad step down the stairs and knew they broke their ankle. Then they'd take action. But they didn't do that unless they were really sick, because they had to pay the full cost. Health insurance was rare. And in 1940, less than 10% of the population had health insurance. Compare that with about 90% today. Something happened that changed insurance from being a very niche product that not many people used and not many people even knew about to expand it across our country to make it what it is today. In World War II, there were wage and price freezes. Employers needed to attract workers. In 1943, the IRS ruled that employee-based healthcare was tax-free. Since then, things have exploded. Medicare and Medicaid have been created, and the vast majority of U.S. citizens now have health insurance of some kind. So, I hope this has been interesting. I hope maybe you've learned something. It's a very broad brush view of the system. We have a lot more content to deliver. This is our starting point, and we're going to build from here. Thank you.